So I gave a talk on radiation oncology value and innovation at the 2020 World Conference of Lung Cancer in Singapore. The conference was given virtually. My highlight was specifically about value in healthcare and about how that can be challenging, and then the specific implications for radiation oncology. So what we know is that value is a hot topic, but that there's really some potentially conflicting attitudes in terms of what constitutes value. So the specific mix of value is generally considered quality divided by costs, but what goes into the quality equation? Are we talking about survival outcomes only? Are we talking about disease specific survival? Or are we also factoring in things like the patient experience, patient convenience, and healthcare system burden? And then for costs, in terms of thinking about, well, what costs matter? So is it costs to the facility? Is it charged costs? Is it actually the costs that are kind of gathered back? Or is it actually, for example, out-of-pocket costs for patients, which can factor into financial toxicity? So all of these components of value really make it a complex topic. We know specifically within radiation oncology, because our treatments individually can be more costly, that value is really important. So radiation oncology really does need to prove its value in the treatment of cancer. And there are different frameworks to consider value. For example, factoring in things like the structural or technical costs related to our treatments, thinking about process-oriented, for example, whether or not our treatments are truly patient-centered. Again, those outcomes, which outcomes matters. Patient-reported outcomes are very inconsistently sometimes used within our field. And then again, the costs, whether or not those costs are transparent and how they're measured in terms of the full cycle of care. Because what we found within radiation oncology is that there can be expensive costs related to our care, but often those costs are not specifically the radiation costs. Radiation costs in the full scope of cancer care actually represent the minority of costs. We have a real opportunity within radiation oncology to show our value with some of our more innovative technologies, even though, again, we're often pointed out as being kind of the expensive part of cancer treatment. What we know is that advanced technologies within radiation really do offer potentially very high value care for our patients. In and of that, they can potentially minimize their treatment time, maximize their convenience, and minimize their risk of long-term side effects. So for example, particle therapy can very elegantly spare normal dose to tissues that might be at risk, for example, the heart. And that in the long term really does improve value. I think, the main deficit and the main thing that I try to highlight in my talk is that we just need better outcomes, and we need better long-term outcomes in terms of some of our emergent technologies. And the potential benefit realized over a period of decades can't be measured now. And so some of what we're doing with some of these cost-effective analysis is trying to truly prove that our treatments are of value to the cancer community. And that they do have a role in terms of curing and palliating disease.